I have an anal plug stuck inside of me. What should I do?
The views expressed by me are for educational purposes only and do not establish a doctor-patient relationship. Hello, thanks for your question. You should take laxatives like dulcolax 2 tablets at a time along with a bulk-forming agent like miralax to help the plug out with the stool. Also drink plenty of fluids. Sometimes, you may be able to use your fingers to get the plug out. If these measures do not help within next 24 hours, then you need to go to the emergency room to remove it by a surgeon. Best wishes.
Does the size of the plug make a difference? It's about 2 inches across at the base.
2 inches can still be passed with the stool. Fingers also can be used if you feel it is in the process of coming out. If very uncomfortable, then you should go to the ER, of course. Best wishes. As a physician with over 27 years' experience in both primary care and emergency medicine, I would have to strongly disagree with the other expert. Attempting to remove this yourself is likely to cause more significant problems, possibly even leading to a perforation of the intestines, a true surgical emergency. While many people who have this type of problem try to avoid the ER because they are embarrassed, I can assure you that this is much more common in emergency medicine than most people might imagine. If you were my patient, I would strongly urge you to go to the ER to have this removed by a physician. Do not try to remove this yourself.
Now I'm confused. Conflicting medical advice. You are right about the reason I loathe going to the ER. I can almost reach the plug but can't quite grab it.
I can understand that you may be confused. I suspect this may be based on the difference in experience between different physicians. I have seen patients end up with serious complications from repeated attempts to remove something stuck in the rectum. Some patients even need to have emergency surgery. There are a number of approaches used by physicians to remove objects, but honestly this is not something you should attempt at home. Sedation, local anesthetics and medications that relax the sphincter may be needed to help remove this safely. This article reviews some of the approaches that are used by physicians. As you can see, there is no single easy answer. http://www.ncbi.nlm.nih.gov/pmc/article/pmc2731197/.
How long should I wait to go to an ER? The plug has been lodged since this morning about 10:30 a.m. CST.
If you were my patient and you had called me about this, my answer would be immediately. The fact that this has been in place for this long is too long. You need to be seen in the ER.
Okay, thanks. I think I will take your advice. This is very embarrassing, but I have no one to blame by myself.
Honestly, in a few years, you'll look back at this experience and have a good laugh about this all. There is nothing to be embarrassed about this. This is a common medical problem.
If you have a health question and want to chat with a doctor now, visit justanswer.com/ythealth.